Welcome back to Beyond the Scalpel. I'm one of your hosts, Dr. Elie Levine.
And I'm your other host, Dr. Jody Levine. You can learn more about us at plasticsandderm.com.
So I see that we have an exciting show today.
Yes, today we are speaking all about eyes. And what happens to your eyes as you age and what we can do to fix those problems.
Yes, it's pretty cool. I happen to love this topic because the fear of a lot of people with plastic surgery is looking like you've been done. And to me, that's obviously disaster. And we keep talking and we keep throwing out people want to look natural, want to look natural. And it's all true. And it's about repositioning things and addressing genetic tendencies rather than trying to do crazy things. But in particular, the eyes and the brow, I can't remember how many times patients come in after surgery and they say, you know what, I got the greatest compliment today. Someone saw me and they thought I looked happy, or they thought I looked refreshed, or I just got back from vacation, or I had a good night's rest, or I'm wearing my hair differently. They picked up on the fact that I look better, but they couldn't pick up on why. And they had some sort of eye or brow procedure.
Yes, good eye surgery is excellent.
Yes.
So let's talk about the differences between the female eye and the male eye. Women tend to have a wider eye, men, it's more narrow. Women tend to have a more arched brow. Men have a straighter brow.
And women have a higher brow. It sits like, so if you feel your bony rim, the male brow generally sits right along there. And if the ideal female brow should sit a good centimeter, which is a good almost, 4/10 of an inch, almost half an inch above that.
Okay, so women's brows are higher and more arched.
Correct.
And men's eyes tend to be deeper set.
Yes.
But as we age, the wide eye of the female begins to get a little more narrow. The brows tend to come down.
Yes.
And our female eyes also become deep set.
Yeah.
And what happened to men as they age?
So men, frankly, a lot of those same features, same things happen. The only difference is that in certain ways you have to be a little bit more nuanced on it. So a low brow position may be too low, and it may be something that you want to totally address in the female brow, and a male patient may come in with a slightly low brow, and you're willing to accept it because the alternative of trying to lift it can create a look of something unnatural.
Right.
So, so that's one thing. And then there's one other kind of X factor that we haven't thrown out there, and that's the genetic tendency. So like all of our, features have a significant genetic tendency. If we have relatives that are bald, there's a good chance we may be bald. If we have relatives that have a bad nose, we may have a bad nose, but necks, those kind of things. But eyes in particular, I find have a first degree correspondence. What do I mean by that? I've basically never seen a patient who came in who had puffy lower eyes.
Right.
And I asked, does mom or dad have puffy lower eyes? I've never heard them say neither of them. They both have perfect lower eyes. Because if the answer is they did, they had surgery.
Right. I didn't get to the changes around the eye also as we age, right? Yeah. So you get puffier.
Right.
Right. Hollower.
Yeah.
Either puffier or hollower. And the skin around the eye gets thinner. You lose collagen, elastin. You get more wrinkles. All of this contributes to the older eye.
So that's the age part. But I wanted to actually throw in addition to the age part is the genetics of it. So I can look at a 20-year-older. And obviously they don't need eye surgery at 20, but I can see the hints of puffy lower eyes then, and I can see the relatively low brow, not low enough that you would even dream of doing anything procedural on that person, but you see where the writing on the wall is. And that's not true of every other feature. So there's some kids, little child you look at, they may have the most perfect nose, and you look at that same person 20 years later, and it's not nearly as perfect.
Right.
The brow and the eyes, you can tell very early on where their genetic tendencies are taking them.
That's so interesting.
Yes.
They show you where they're going at a younger age. That's very cool. Okay, so let's talk about what we do to fix these things.
Oh, so much to do.
Okay, I'm going to start.
Start.
Thank you. I'm going to start with neuromodulator, Botox. Botox is great. It's always my first go-to for the eyes. It helps with the crow's feet, the lines coming out of the eye. One little trick of mine is, in addition to treating the crow's, you also should treat the bunnies, which are the lines that go along the nose. It just keeps things looking natural.
You taught me that, because there's so many times where we'll see people socially and they'll be like, I do Botox, and they'll smile and like, oh, they didn't do the bunnies.
Okay, but we're getting off topic. So crow's feet. Another really good place that I enjoy placing Botox is right under the eye in the center. And what that does is that actually widens the eye. So as we age and our eye gets narrower, that's a really, really good Botox spot. It's one little injection under the eye, and every patient always says, "Are you allowed to go there?" And I say, "Yes, I promise it'll be fine." They don't even feel it, and it widens the aged eye.
Makes sense. Because you're relaxing that muscle that
exactly,
the eye.
Exactly. We can also open the eyes up by Botoxing the muscles in the glabella, right in the center, because those pull down the brows. So if we Botox those, it lifts the brows, also opening the eye. We can also Botox along the brow to shape the brow and fix the arch. And there's one little sweet spot at the edge of the brow that if you Botox that, it lifts the brow. So there's a lot of shaping we can do with neuromodulator around the eye.
And, Jody is outstanding at injecting Botox. You can get Botox anywhere. You don't even necessarily need to go to a physician. There are med spas and all kinds of things. And probably in certain places on the face, in certain patients, it probably isn't all that different. But there are certain places where you can get into real trouble. I'm not talking about real trouble like danger trouble, but cosmetic trouble if you inject these things wrong. And like you said, that sweet spot matters. If you're a little more to the right or left,
yes,
it affects it.
Right.
So there really is a real skill to Botox.
Just disclaimer, we're using the word Botox because that's what's familiar for most people, but we're not necessarily using the name brand Botox.
Yes, no. Frankly, we
like Xeomin, we like Daxxify.
Yeah.
Yes.
We use Dysport.
We use them all. It depends what we're after.
Yes.
Okay, so that's the neuromodulator, and now I want to talk about filler before we get into surgery, because there's a lot we can do with filler.
Can I ask you one more question on Botox? Sure. Is there someone who's not a candidate for Botox? Talk about cosmetic.
Okay. Well, first of all, I'll put that back to you, because that lower sweet spot that I referred to, right underneath the lower edge of the eye, lower lid, I guess I should say, there's a test that we do where we pull on the skin of the eye. And if it doesn't bounce back, we know that the eye is too weak. The muscles are too weak and we cannot Botox there. You can describe that better.
Yes. So and we'll talk about that more when we go into blepharoplasty, but lower lid tone is something that has cosmetic implications, because as you age, that lid can drop down, and the term we call a scleral show, but basically you're seeing more of the white part of the eye and it just looks less attractive. The other factor is it can contribute to feeling like you have dry eyes. Now, dry eyes can sometimes be a misnomer of sorts, because the symptom of dry eye sometimes is that you over tear because your body's trying to compensate and produce more tears. So sometimes it manifests as feeling dry, sometimes it's actually tearing more than you want. But either way, it's because of kind of a weakened lower lid tone.
Yes, so we will not weaken the lower lid further if someone already has a weakened lower lid tone. That is a very good point. Thank you. And that also is a distinguishing point between a good injector and someone who is really not as knowledgeable. So thank you, Dr. Elie.
Yes.
Can I speak about filler now?
Let's talk about filler.
Okay. So for hollow under eyes, we fill. We put in a natural hyaluronic acid filler. It has to be the right one that's not too thick. There is a color change when hyaluronic acid is put too superficial, where you see the bluish color through the skin. It's called the Tyndall effect. So I use a particular filler that does not give a Tyndall effect. I also place it in the right place so that you all get it. So it does matter who does that as well. But anyway, so that's an obvious one. We put filler in an area that needs to be a little fuller. But other tricks, you can put some filler along the edge of the brow to lift the brow. Very thin filler, has to be placed, not too much, but it really does a nice job. And where else would you use filler around the eyes?
Well, the lower eyes hollowing, but also puffiness, to kind of camouflage puffiness. So if someone comes in, they don't like their puffy lower eyes, they're either not a surgical candidate or they don't want surgery yet.
Correct. I always say my one option is we can camouflage that bag, as we call it, by putting filler around it, or if someone does not want to do that and they're willing to do surgery, that is, of course, the better option.
And the camouflage is an issue because the reason why it works is typically people have puffiness. They have puffiness, and then they have a little hollow below, which is that transition point from the eyelid to the cheek, and then they have their normal cheek. And so you put it right into that junction between those two things, and you no longer see the depression, but similarly, it camouflages and masks that puffiness to some degree.
The only problem I see with that is that when we do filler in that region underneath the eye, sometimes we can get a little swelling.
Yeah, it's an area where you get edema, yeah.
You do get edema, you get swelling, and it resolves. But when people already have that puffiness, that bag, which is really just a collection of fat, it lasts longer.
Yeah.
So sometimes it exaggerates the bag before it fixes it. But in the end, it looks good.
Right. What about, what do you want to talk about after fillers?
So there is laser that we can talk about to help the skin around the eye. I really find if someone has a lot of lines and a lot of crepiness in the skin around the eye, I want to go after that with a ablative laser. The erbium laser, which basically is like taking sandpaper and sanding down the skin to make it smooth and also increase collagen production. There is a real recovery time with that. It's good 5 days, 3 to 5 days.
We'll call it social downtime because like you're not in pain. It's not that kind of downtime.
But you're red. But then again, it's worth it. Totally worth it. But I think more exciting is surgery. I always think surgery is
one
exciting.
last thing, just to tie it all together.
Yes.
When you do the laser resurfacing,
Yes.
I generally find, and you tell us to me all the time, you want to kind of do their Botox probably a week or two before. Because what happens is these are wrinkles that form from animation. Every time you smile, you frown, you animate. And so if you laser resurface that and you have full motion in that area, it's kind of like if you have a pair of linen slacks. You take them to the dry cleaner, you take them back, they're pristine, they're perfect. You wear them for 6 minutes and they look like they need to go back to the dry cleaner because those wrinkles want to reform.
Right.
So you want to limit and smooth out those wrinkles and then treat them. And then you really get a lasting effect from it.
That is a trick that you taught me, that we do Botox first before we do certain lasers. And one of my favorite ones that you taught me is the neck. We always Botox the platysmal bands, which are the muscles that are pulling down the neck, pull back the neck before you do laser tightening of the neck, because that really enables the laser tightening to work.
Yeah.
Okay, let's talk about surgery.
Yes.
Okay. Tell us, what is your favorite? I know the answer, but what is your favorite surgery to do around the eye?
So, well, probably my favorite surgery around the eye is not the eyelid surgery. It's more the brow lift surgery.
Correct. I knew it.
So we'll talk eye, but then we'll talk about your point because your point's a very valid one. So I guess we'll finish up the lower eyes. So healthy eyes, surgically treating it, there are two general ways to treat the lower eyelids. The more traditional ways, making an incision along that lash line there and addressing the fat and addressing the skin and everything else like that. It's a technique that I really haven't done in like forever. And the reason why is it's technically still done. There are still, practitioners that do it, but it creates a significant amount of scarring in that area. And scarring that area can have both cosmetic and functional implications because when that area scars, it retracts. And when it retracts, gravity playing in the role, you can get retraction this way, which is really bad, both cosmetically as well as physically.
Brings us back to dry eye.
Correct. So the safer and better way to address it is to go in through the lower eyelid. We're going nowhere near the eye, so we're not affecting the vision at all. And what I'm doing is a couple of things. I'm sometimes taking out some of that fat, but I'm in no way taking out all of that fat because I don't want to hollow out that area. In fact, what I'm doing is I'm taking that fat underneath the skin, draping it underneath the skin into that hollow area. So I've gotten rid of the puffiness, I've gotten rid of the hollow, and it looks really smooth. Now, that eyelid test, that weak lower eyelid, what I find really works well is I make a tiny little nick near the edge. It's not going to weaken the eye. It's not going to cause scar tissue because it's not kind of going all the way across. And I internally place a stitch that tightens that lower eyelid. It gives it kind of like an Asian look for about a week. Even if you love that look, it's not going to stay. It's a temporary effect just for a week. But what it does is in the short run, it helps get rid of that swelling faster. In the long run, it has both cosmetic implications because it tightens that lower eyelid, but it also prevents dry eyes.
Okay, so for the lay person, can you explain what is the difference between the two techniques? One of them, you're making a cut along the lash line.
Yep, and then cutting through all the layers underneath in order to access the fat.
And what are you doing differently in the other one?
I'm going into like the lower eyelid, so I'm actually approaching it from the underside.
So you're actually doing your work inside the eye,
and I'm approaching
instead
it,
of
correct.
going at the edge.
And there's no question it requires more skill. I feel comfortable
It
that
does.
that's all I've
It
done.
does.
And not everyone feels like they have that comfort
Yes.
level, but it is a safer and a more predictable way and avoids that whole scarring issue.
Yes, and I will say there are a lot of dermatologists, not a lot, but there are some dermatologists that do lower blepharoplasties. They do this surgery we're discussing, and they do not go in the eye like you do.
Yeah.
They go on the edge, and it is not as good a procedure.
Yeah. So that's the lower eyelid. You can resurface at the same time if there's a benefit to it, if the skin is kind of crepey and thin, so you can, combine these modalities.
These do work together.
Yep. The recovery there's like almost no pain. I would say there's 1 week's worth of social downtime, but it's not social downtime that you can't go out and get a cup of coffee with a pair of sunglasses on. It's just if you were meeting someone in a social setting and didn't want them to know you did surgery, it's about a week's worth of downtime.
Okay, so when people are wearing their sunglasses at night in a restaurant with me, it is possible that they did eye surgery that week.
It is quite possible. Yes.
Okay, I just thought they wanted to look cool.
Well, maybe a little bit both. The upper eyelids, we didn't really talk about that.
Yes.
The upper eyelids, sometimes people have excess skin there, and that's actually a pretty straightforward, easy procedure. In fact, that you can even do under local. You don't even need to go to sleep for that, and you end up getting a scar in your natural crease, which means you're not really going to see a scar at all. And that's also something that I'd say has about 1 week's worth of social downtime, works really well. Now, that operation, I have so many patients that come in saying they did that operation with someone else, and they feel like it's come back.
Yes.
And they may have come back 6 months later, maybe even 2 years later, but it's not 10 years later. It's a short time later.
Very short. I've seen it after 1 year.
Yeah. And it's not that it's come back, because what's happened is if I push down on my brow, that eyelid skin becomes more redundant. So our brains are wired to protect our upward field of gaze. We want to be able to look up because, I guess, from an evolutionary standpoint, danger was in front of us, below us, but some bird could grab us out of the sky, so you needed to be able to look up. In order to protect that, our brain is constantly assessing how much extra eyelid skin, how heavy our brow is, and all those things. And it's working these forehead muscles, these frontalis muscles, to do that. And so when you take out that little bit of eyelid skin, the brain says, oh, wait a second, that little obstruction's gone. We don't need to work these muscles as hard. And your brow actually drops down. And that problem becomes exacerbated by actually doing that upper eyelid surgery.
Yes, so people who only take out the skin and don't lift the brows end up with a problem.
Now, I will say that a lot of practitioners do that for a few reasons. One is that technically this is a easier operation. I wouldn't say easy, but easier than the brow lift. And the other is the equipment you need for a brow lift is actually specialized equipment, expensive. And not everyone, unless you're doing something a lot, like I am, they're not using that equipment at all. And so they don't have it. And so what we're really getting at is a brow lift. And that actually kind of ties in what I was asking you earlier. You answered the question of the lower eyelid. You actually threw something in that I forgot about, which is great. But I was thinking about the forehead lines, which is not really the eyes. When you're talking about using neuromodulators, there are people that come in that have a ton of forehead lines.
Okay, yeah.
And they come in and they have pronounced forehead lines. They're terribly looking.
Yes.
Thick and you can't get rid of them, and the patients are coming in begging for Botox.
Right, that's different. That's we're talking forehead.
Yeah.
Okay. That's a very good point that you're making. That there are some people who cannot have Botox on their forehead, meaning we will not do it for them because it will lower their brows. You need your forehead muscles to lift your brows.
Right.
This is not the muscles I was referring to Botoxing. I was referring to Botoxing the muscles.
Purely for the eyes. You are eye-centric.
I'm sticking to the topic.
Yes, I'm getting off topic.
You are getting off topic.
So the brow lift is one of my favorite procedures. And the reason why is we'll call it scarless. And the reason why it's scarless is I do make 5 little incisions inside the hairline, but we're not trimming hair, we're not moving hair, we're not losing hair. And so even a week later, there's nothing to be seen, even when all swelling is gone. The other thing is, it is trying to do something natural. It's trying to reposition your brow where it should sit. It's not trying to create anything artificial, weird. You're not doing this in someone who doesn't need a brow lift, so that fear of looking like a deer in the headlights is not going to come to fruition.
You need your brows lifted.
Right. So that's the candidate for the operation. And it's like an under 2-hour operation. Soreness, mild soreness, not really pain, a week's worth of social downtime.
Do you need to be asleep?
You do.
Okay.
Yeah. And but it's a seamless recovery and can be combined with doing the lower eyelids or doing something to the upper eyelids. Because it's not that that's never an issue, the upper eyelid skin.
Yes.
It's just oftentimes not the main issue.
I have to say, it kills me that not every plastic surgeon does
Yes,
this.
I know.
Because I have patients who come to me and don't use you, and I know, but they're going to another plastic surgeon to do their upper lids, and they're taking out the skin, and they're not doing their brows, and it just pains me because I know it's not going to work out.
Yeah. So the outcome of that surgery, the brow lift surgery, is you look awake, refreshed, happy, and those wrinkles go away. The wrinkles aren't going away because I'm taking out the wrinkles or doing anything. Really, what I'm doing is positioning that brow where it wants to sit.
Right.
And the brain suddenly says, oh, we don't have to work those muscles as hard that create those wrinkles because we're positioned properly. And so the wrinkles, I wouldn't say you never need a neuromodulator, but you need less of it and less frequently.
You need less of it, but eventually.
Well, we're still not 20 anymore.
Right. So like initially after someone has a brow lift, I don't do Botox in them for a while in their forehead, but then eventually we resume. Okay. I think we covered eye surgery.
We did do a lot. Now, one other thing for brow lifts, if you like Google brow lifts, there are what I'm describing as an endoscopic brow lift where I'm putting in a camera through the little access points. There's also a temporal brow lift where you're really just trying to get rid of the temporal hooding. There are a rare number of people where that's their isolated problem, and then you only need to make a little incision in here. When I'm doing my endoscopic brow lift, I'm doing that as well more often than not because it's usually not just a this effect, it's a this effect.
Right.
And then there's a coronal brow lift, which is a incision all the way along here, which I don't think I could pay someone to do in New York, but like that scar can be horrifying and hideous and insane.
We didn't discuss thread lift for brows because I do that as well.
Yeah.
It's subtle.
Yeah.
There's absolutely no downtime, and you barely feel it, and it's quick. So there is virtue to doing it. However, it's very subtle.
Right. I mean, that's someone who has like an event coming up, or they're not a surgical candidate, or they don't want surgery at this point.
Right. Of course, there's topical creams, retinoids that we use around the eye, moisturizers, hyaluronic acid, various things that help, decrease the appearance of wrinkles around the eye. So I don't want to forget about those things.
Are we missing anything?
No, I think we're good.
I think we are great.
Okay.
So should we get to our guest?
Our guest.
Dr. John Huber.
Wait. I forgot one more thing for the lower eyes.
What did you forget? You never forget anything.
Fat grafting.
Ooh, yes, that's great.
Fat grafting is phenomenal. We speak about it a lot because we love it. I particularly love it in the lower eye. You want to tell us about that? Yeah,
so for people that don't really need they have a little bit of hollowing, they want something more permanent than fillers, but they don't need they don't have puffy eyes, they don't have issues like that. I'm using, I'll call it micro fat transfer. So I'm using the tiniest, thinnest fat. I'm using the tiniest cannula with it. I'm using essentially a needle to place it. I'm not even, it's blunt, so it doesn't, create any kind of trauma, but it's the size of a needle. It's really quite tiny.
Right.
And it just subtly gets rid of that puffiness, that hollowness, and it's a permanent correction to it.
It's permanent. It's great. I mean, I've seen so many patients who had fat transfer, and I think you did surgery.
Yeah, and sometimes it's just the eye. Sometimes I'm integrating that when I'm doing eyes in a facelift or something like that. You can also, it's not really the eye, but we'll call it that, is the temporal hollowing. I mean, obviously you can use fillers in that area.
Yeah, I love putting filler in the temples, but that's right. Thank you.
You can also use fat there too.
Filler doesn't just fill, it lifts. And if you have hollowness in your temples and you put some filler there, it looks totally natural because you're just filling in an area where you lost volume. Yeah. And it lifts, so it opens up the eyes. Yeah. And that's actually one of the first things I recommend when I see people whose eyes look small who have hollows in their temples.
Yeah, we're seeing more and more people like that, but that's for another episode.
Right.
We'd like to welcome Dr. John Huber to the show.
Hello, Dr. Huber. Dr. Huber is the CEO of Tripsitter.clinic. He is a clinical forensic psychologist. And we have a lot of questions for him.
Yes, he is without question a mental health expert. And our episode today is on the eyes. And I'm wondering if we can tie this all together.
Yes. Before we talk about the eyes, though, do you want Dr. Huber? Welcome.
Thank you for having me. I'm really excited to be here. And, anything mental health, I just love talking about, because the more we talk about it, the less stigma there is associated with it. And so many people need help, but they're just afraid of the embarrassment of admitting they need help.
So I fully agree with you. Can you tell us a little bit about Tripsitter.clinic? What is that?
Tripsitter.clinic is an online essential clinic. We do psychotropic use of ketamine for our patients, and we were the very first to do it completely online. Now there are a couple other competitors, and unfortunately for me, they have a lot more funding behind them. So they are spreading like wildfire, and that's great. I've got other ventures and I do other things. And my biggest thing is trying to help destigmatize mental health. And I was a university professor for 21 years. I stopped in 2017. And that is part of what I've done since day one at the university.
Interesting. What university?
Texas State University.
Texas State. Okay.
Yeah, there's no question that mental health plays a more important role understanding it definitely post-COVID. And I would say that even pre-COVID in plastic surgery and aesthetic care in general, you have to understand where someone's coming from psychologically before even talking about anything
That's
procedural.
Right. One of Dr. Elie's first publications in a medical journal was on the psychological effects of facial trauma.
Right.
Awesome.
So so it's definitely a vital part of what we do, and clearly what you do.
So
yeah, one of the first patients I had in private practice was a 14-year-old girl who had her face mauled by a pit bull at 12. And reconstructed her face. That there was only one little scar you could see, but she was looking at a different person in the mirror every morning. That was really hard.
Yeah.
So hard. So I feel like there are many issues we can address, but because today's podcast was about the eye,
Yes.
Curious to know from you, what do you learn about a person by seeing their eyes when you're speaking with them? They're like, what signs can you find in someone's eyes?
Well, it's interesting. As a forensic psychologist, I'm often asked to go and talk to some people who aren't very nice. Oftentimes we're in a prison or a jail setting. And it's really interesting, how people who aren't telling you the truth tend to do different things with their eyes. And it's very controversial. There's so much debate. We always talk about, your right brain is the creative side and the left brain is the logical side. Well, if you look up to the left, you're actually looking to the right hemisphere. And so that could be an indication that you're in the creative imagination side to come up with a lie that I might buy. Versus if you look up to the right, which is contralateral, again, you're looking at your left, that may indicate that you're actually recalling memories and actually telling me something more along the truth. The issue is there's about, forget about left-handed people. The left-handed people switch, so the two are switched. But within both left and right-handed, there's about a 10 to 15% population in both of those groups that are contralateral anyway. They're reverse what they're supposed to be. So the left-handed person is actually in their left mind like right-handed people are in their left mind, so to speak.
So it's not that reliable is what you're saying.
It's not reliable. That's part of the controversy. Now, there's some lie detector tests that are out there that, lie detectors, we know that there's really no good way to definitively say whether somebody's lying because they're too easy to defeat physiology. When I increase your heart rate, we'll put a tack in your shoe and step on the tack. And now you've complicated things and they can't tell if you're lying or telling the truth. But an interesting thing, they can tell what you like. They actually use these lasers that measure the diameter of your pupil. And when you see something you're attracted to, it gives a very brief enlargement of that, of the diameter of your pupil. So, in fact, some of the three-letter organizations in this country, when they go through and they take their agents or whatever, and they're running them through these things, because if they're a spy, for example, one of the things they're going to try is, besides torture, they're going to try a lie detector test on just to see. Well, they're also interested in what might be able to manipulate. So if you're kind of a playboy, you have the possibility of having women come after you. Well, one of the things they can do in that test session, they watch your eyes with those lasers, and they can flash pictures of different, women with different hairstyles. All that. They can pretty much pinpoint what you're going to be attracted to before you go out in the field. So they can monitor you from a distance. Now, a lot of people deny that they actually do that. I've talked to some FBI agents and some other three-letter agency places that individually, face-to-face, they've told me they do it. But I don't think it's a real policy that they have to do it to everybody. But it's interesting that people are using that information. And essentially, they could potentially out somebody who's attracted to the same sex if they flash that naked body of the same sex and the pupil dilates. That is an indication that you're attracted to that image.
Interesting. You threw me off for a second when you said that you sometimes come across people that are, unsavory. I thought you were talking about the attorneys, but then you were talking about so,
well, you got to remember 99% of the attorneys give the rest a bad name.
Yeah, that's very funny. Okay, so let's talk about the mental health effect of the shape of the eyes. Like as we age and our brows fall and our eyes sort of, the skin of the eye begins to cover the eye. How does that affect someone's mental health?
Well, it usually affects other people's mental health and how people perceive you and how they react to you. And that's where something like having an eye lift can be very beneficial. Your eyes look tired, whether you are or not, people are going to treat you much differently.
Right.
And a more social setting is look at what they do in Japan and sometimes in Taiwan. They're trying to round out the eyes so that for some reason, the image of beauty now is that you don't have narrow eyes, round eyes, very American. And
you're hitting on a really good point because I would say that there are a large number of my patients that undergo eyelid surgery are men, a pretty high percentage. And a lot of times they're coming in, not even necessarily saying that they feel like they want to look better. It's more that they want in the workplace to not look older or look less tired. It's not purely a cosmetic. It's actually something that has practical value to them. And so, yes, they're being judged by their eyes.
Can I get your number? No. I know, and I've used some teach, doing a lot of television and radio and things like that. I've met some makeup artists, some models and stuff. And one of the things that they recommend is actually put Preparation H right on those bags for 10, 15 minutes, maybe with a little Noxema or facial soap or something like that, and then wipe it off. And it does. It's amazing how much it just makes you look like you're on spot. So I can't imagine if you get a permanent fix for that. How much?
Yeah. Right. No, it's true. Preparation H does take down the swelling and it does, smooth out those bags. But it could be irritating to the skin, and sometimes people get a rash and irritation, and then we have to treat that. So you do need to take it off. You can't. Sometimes people leave it on for too long.
That's wrong. Yeah.
So
moderation.
Do you think?
Yes.
Do you think dark circles affects the emotional well-being of the person, or just the way they're perceived by others?
Well, see, and how people react to you also sets you apart and starts making you feel differently if they treat you differently. For example, with the type of thyroid disorder, you get dark rings and sunken eyes. And I have a lot of patients who that's why they came to me. They were, hey, people are treating me differently. And then I'm like, have you had your thyroid problems identified? And they're like, what? And they go and it's like, wow. And, they start getting the medications and the treatment for that, and it goes away, and their problem does too. So it's a real thing. It's not something that's just built in somebody's head. People treat you differently based on how we look. So if you want to be the boss, you need to come in dressed like the boss, and that includes how you pay attention and focus. Eye contact. People who don't make eye contact with you, you don't trust them. It's just a normal thing. But if they stare at you, it's just now they're mad at me. So there's a happy medium, and we all interpret things differently.
Right. I actually always tell my patients, sometimes people come in, usually I say to them, what are you looking for? What bothers you? But often patients say to me, well, what do you think? Look at me. What do you think? And I always go first to the eyes, because I say that's what people look at first. When I look at someone, I'm looking straight at their eyes. So let's fix that area first, and then we move on to everything else. Do you find that when people are depressed or anxious, they don't make eye contact?
They don't. They don't. And it's a bad thing too. I mean, in cities and large populations, you become a target. You're walking down the street, you're depressed, you're not paying attention, you're not making eye contact to the people around you. That's perfect for somebody who's a potential perpetrator, because they know you haven't even looked them in the face and couldn't give a description of them if you had to. So
Right.
it sets you up for a lot of negative experiences, period. So pick yourself up, go get a psychologist, go get your eyes done. You'd have a much better life.
Yes. And I think this last question is going to be not so good for business, but is
And
there
then we'll cut to a break.
is there truth to the fact that when somebody cannot express with their eyes, let's say they have too much Botox, it causes mood changes?
Well, again, people act differently to you. So if you're grandma and you don't like the wrinkles and you get all your Botox, and then your 3-year-old comes over and you're smiling at them, but they don't see a smile and they can't understand it can be very frustrating. And now all of a sudden that 3-year-old starts throwing this fit and you get frustrated, and it just becomes a snowball rolling down.
Yes. So
Moderation.
there is an in-between. All right.
This was great.
Wonderful. I hope we can call you again, because we have so many areas that we need your expertise for.
Hey,
Yes.
I love this, and if I'm not giving you what I want or what you want, tell me, because I can take this anyway. I could take it very serious. I could get comedic. It's you should hear some of my stories of working with people who threaten to kill me every day when I walk into the hospital, and
Oh, God.
and
And those are the administrators.
don't even go there with that, because I have privileges at a couple medical hospitals, and I'm on one of the committees that reviews the deaths and everything, and it's like I always have to ask all these questions because I don't make assumptions, because I don't know enough about specific surgical procedures, and it's like the administration there's like, oh no, I'm gonna find something. Because everybody just assumes, and I don't, because I don't know. So.
Thank you for joining us
Thank you
today.
for joining us.
You're welcome.
And, so that concludes our latest episode of Beyond the Scalpel.
Thanks, and we'll see you here next time.